Hi, my name is Sarah.
And my name is Sarah.
Today, we're going to demonstrate how to prepare and break down your cubicle before and after patient care.
And to
The Smiley Standard. We all know that following proper infection control procedures provides a safe working environment for clinicians and shows patients that we are creating a safe environment for them by minimizing the risk of cross-contamination. To begin, we are required to be in proper clinic attire and appropriate PPE. We have gathered everything that we need for today, which includes mask, protective eyewear, gloves, yellow gown, paper towels, sanitization product, disinfectant wipes, sterilization tape, saran wrap, computer covers or large plastic covers, and a patient assessment kit or scaling kit. And these actually contain more of the protective barriers that you will need to prepare your room. The first step is to fill the water bottle and attach it to the dental unit. For these units, this is accomplished by pushing the water bottle up and then turning it to the left. Once you have filled and replaced the water bottle, go ahead and turn the unit on by flipping this switch up. Now we can put on our mask and protective eyewear. After that, you can wash your hands with soap and water for 20 seconds. The sinks at the new school are intended to be hands-free. To turn on the water, make sure the faucet is turned on and then press on the kick plate. Disposable towels can be used to dry your hands before putting on your gloves. We sanitize our operatory by using Joy Water, which is just a combination of Joy dish soap and water. If this is not available, a wet paper towel can be used to remove dust and debris. Be sure to wipe down all surfaces. On the patient chair, it is especially important to pay attention to all of the small details. When preparing my operatory, it's helpful for me to think about what type of environment I would want my dental procedures performed in.
Love is like a mouth, warm and refreshing if you take good care. On the flip side, it can be sticky sometimes. If not brushed daily or needs repair, enamel can wear over time. Be sure to tend to your teeth. They can be strong and white and healthy. Don't let them decay from underneath. And take good care of your dental love.
For the new chairs, there's a protective covering over the lights that can be wiped down once a day. However, the plastic covers should not be taken off unless being replaced. As of right now, we are waiting for replacement covers and further instruction on how often to change them. The outside of the operatory computer monitor, the keyboard and mouse can all be wiped down with a disinfectant wipe. The screen should only be cleaned with a soft tissue. At the foot of the patient chair, there's a plastic covering that is held in place by Velcro. You can release the Velcro at the bottom in order to clean under the plastic. After wiping everything down and after the chair dries, you can wipe the surfaces using disinfectant wipes. In order for the disinfectant to work properly, the surface should be visibly wet. If it is not, you need to use a new wipe. Remember to use the wipes with the gray label on these new chairs in order to preserve the material. Also, it is critical to wait until the surfaces are completely dry before placing any protective barriers. This allows time for the reduction of microbial contamination.
And graces, how can I express my thankfulness to you after all my carelessness? Because I did not floss and brush, you had to remove right calculus.
Once everything is dry, you can start applying your protective barriers. It makes no difference what order you apply them in, and there can be slight variations in methods as long as all of the appropriate surfaces are covered. Saran wrap can be used to cover bracket tray handles, unit control pads, the arms of the patient chair, light handles and switches, table, the back of the operator chair levers, as well as the assistant chair lever.
That I should always fuss and rush, so I won't have any calculus.
I prefer to use a large plastic cover over my bracket table, as well as two for my computer, which I prefer to place on the cart for easy access. But saran wrap can be used here as well as on the operatory computer keyboard and mouse. But when utilizing large covers for your laptop, one goes over your screen and the other can be taped under your laptop in such a way that it can actually be flipped over your keyboard. This actually allows the clinician to utilize the keyboard with gloves on during patient treatment. If you prefer to connect your laptop to the operatory monitor, the IT folks suggested that we store the laptop on this shelf. It even has an outlet for you to charge your computer. I also like to keep the case for my loops over here and use the outlet to charge my extra battery. Next, I like to open my screening or scaling kit. I place the bracket tray cover on the bracket tray along with the cotton tip applicators, gauze, and floss before placing the remaining barriers, which go over the suction and air water syringe, as well as the headrest.
I give lots of OHI. I hope the patients will comply. That's what hygiene's all about. That's what hygiene's all about. I can't wait to graduate.
In the screening kits, you will find a cover for your thermometer and two blue rubber protective barriers. These are used to cover the pen or pencil that you will use when you are wearing your gloves during treatment. I prefer to also keep a pen and pencil that are not covered on the counter so that they can be used when I'm not wearing gloves. And that's actually everything for your operatory setup. Now you're ready to treat your patient.
I wanna be a dental hygienist so freaking bad. Scared of all the calculus I never had. I wanna be on the cover of RDH magazine, smiling next to Esther Wilkins, the hygiene queen. Oh, every time I close my eyes, I say my name with an RDH. Yeah, a different patient every hour. Oh, I swear the world better prepare for when I'm a dental hygienist. Yeah, when they all have my diploma, 'cause right now I'm the host of Everyday Stress. Be a patient and take it on 5 minutes. I'm probably pulling all-nighters, studying for these sentences. I'm screening all these patients with calculus and canvas. You always please people who couldn't care less. And last but not least, find a clinical vocation. Pay him what he wants so I can pass this. Then it's just a waiting game. I wish I knew what was fame. Waiting for the letter in the mail to here you go. So I can put high school behind me and make that dough. Well, you know, everywhere I go, I'ma have my own thing.
So what's next after you have completed and dismissed your patient? It's always best to assume that everything in the operatory is now contaminated and potentially infectious. So for breakdown, your PPE consists of the gown that you were wearing during treatment, your mask, protective eyewear, and gloves. Remove all protective barriers and disposable items and throw them in the garbage. Because we share operatories and trash cans, it is recommended that you never attempt to compact the garbage as they may contain potentially hazardous items. If you have any sharps, place them in the nearest sharps container. Once all of the barriers are removed, you can remove your gloves and replace them with a new pair. Anytime I replace my gloves, I like to use hand sanitizer. Really, it's just a good habit to get into because you will be doing it a lot during patient care. Go ahead and disinfect all surfaces and non-disposable items using the appropriate wipes. Once you've finished, go ahead and remove all of your PPE.
Don't want me to bleed.
On your last day of clinic for the week, the water bottle needs to be emptied. The bottle just goes back onto the chair after you've emptied it. At the end of the day, the patient chair should be raised with the bracket table centered over the chair and the light centered over the bracket table. The rheostat should then be placed on a paper towel on the chair to allow for proper cleaning of the floors by janitorial services. Place the operator chair under the desk and then turn the unit off. And you're done.
We really hope that you enjoyed our video, and we wish you the best of luck in clinic.
Good luck.
Bye.